It was on Tuesday, and we were actually in the middle of, we scheduled 2 town hall meetings for our staff so that we could provide information and answer questions and concerns from our staff people. And in the middle of the town hall meeting, we had people in different offices on the go-to meeting so that they could see us talking and we could answer questions. And in the middle of the town hall meeting, somebody's phone rang on the table, and it was Joe's phone. And Joe Pluth, and he was not in the room at the time, and so Matt McClung, who was one of our presenters for our staff that day from the pharmacy, picked up Joe's phone and left our go-to meeting to answer the call, and it was actually Aberdeen. And our vaccines are coming from, and we're getting our supply through the Indian Health Service, and so somebody from the Aberdeen area office called and let him know in the middle of our town hall meeting that our vaccines were available for pickup. And we just started putting in our action plan to arrange for transport. We sent two of our staff people to drive to pick up the vaccine. The Indian Health Service is part of Operation Warp Speed, and the Indian Health Service in that distribution plan is basically considered the same as a state. And so our vaccine supply is coming through the Indian Health Service Great Plains area. And the Great Plains area decided to have 2, it's basically like a hub and spoke type of system. And so they set 2 hubs where the vaccine would be shipped to the Great Plains area. And those locations are in Pine Ridge and Eagle Butte, South Dakota. And so we had prearranged that our supply would come from Eagle Butte. So we set up 2 of our staff people, one from pharmacy, Matt McClung, and our director of nursing, Joe Pluth, were designated to go on the first run to pick up our COVID-19 vaccine. So they quickly made arrangements with each other to meet early on Wednesday morning, and they left at about 8 a.m. and they were back around 5 p.m. with the COVID-19 vaccine. Matt, our pharmacist, was texting me throughout the day just to let us know how things were going and that they were on schedule. He sent me a text message when he was in Sioux Falls and again when he got to Sioux City. And so a few of us went out to the front main entrance of the hospital and saw him drive up. And it was very exciting. It's been a stressful year. A lot's been going on, and our staff and our team here at the hospital and in the health department and throughout the community have been working so hard to keep our community safe. And to see their car pull up and know that they're bringing a vaccine that is going to protect us from this virus, it was very very heartwarming. And just a really exciting time to be a part of it, to witness that, and to know that the end of the pandemic is coming.
All right, good morning, everybody. It's really good to see all of you here today. We're all very excited to be here together this morning at the beginning of the end of the COVID-19 pandemic in Winnebago. It's been a very challenging year for all of us. And we've been looking forward to the day that the vaccine would be here to help this process of preventing further spread of COVID-19 and ending the pandemic. We wanted to recognize this occasion this morning and start things off in the way that we do as Ho-Chunk people, with a prayer. We've invited one of our spiritual leaders in the community, Mr. Clint Free, to come and offer a word of prayer as we start this day, in order to provide blessings for all of us as we start through this process. We want to bless our vaccinators who are going to be administering this medicine to our people. We want to bless those who are going to be receiving the vaccine so that it helps keep them safe, keep their families safe. And we want to bless all of our entire community, because it's been challenging and stressful for all of us, and we are ready for this pandemic to be over. As we move into this prayer this morning, we know that the Creator is looking down upon us and will help us through this. And we are all in this together. In our community, we have a number of spiritual leaders, and our hospital is named the 12 Clans Unity Hospital in recognition of the 12 clans of the Winnebago Tribe of Nebraska. Every clan member and every clan in our tribe has a role and a responsibility. One of the responsibilities of the Wolf Clan is public health. So Mr. Clint Free's a member of the Wolf Clan, and we thought that it would be very appropriate to invite him here today to help us through this process. So I'd like to introduce Mr. Clint Free, and he's going to begin with a word of prayer, and then we are going to invite Ms. Chairwoman Tori Kitchian to share a few words with us.
First of all, wish everyone good morning, and I thank you for the, thank the tribe, for the honor for asking me to do this. Said that the Wolf Clan is the shaman of, if you will, of sorts for the tribe, and it's fitting that they asked the Wolf Clan to take care of this for them, for our people, and I appreciate the honor in taking care of this. I'm going to go ahead and do a prayer now. So if you bear with me for a few moments, we're going to go ahead and take care of that. Okay? Oh, Creator, I come to you this morning, on this beautiful day that you have given us, and I thank you for another day, on your creation, and everything that you have done for us, up to this point. I thank you, for the food that you provide for us, the water that we use, to keep us going, sustain life, and the dani that you provide for us that we use and use to pray, and I hope you hear our prayers. Today is a very special day for our people, and first of all, I want to again thank you for this day. And with that, there's the sickness that is upon the creation. We hope to get through it, as we all come together to fight this, and it brings our people, close together to help each other out, which is, maybe that's what you're trying to teach us, during this time. Maybe we're falling behind in that, but our community, our leaders, our people have come together to take care of one another, and we thank you for everything that you have given to us. The people that you bring together to take care of this, to take care of each other. The doctors, the scientists, that develop this, to help us combat, this sickness that is upon us. Ask for a special blessing for them. We appreciate, all their hard work, the knowledge that they've acquired, that they can use to help one another. And I'd like to ask for a blessing for all the health workers here in our community, that have to fight this, every day in and day out. Keep them strong, keep them safe. And with that, Creator, again, thank you for the people that you brought here today, and this medicine that has been given to us, and we ask for a special blessing, so that we can use that and to help us combat, get rid of the sickness that is here, for our children and for our elders, keep watch over them, keep them safe. We try very hard, to try to keep them away, from the sickness, keep the sickness away from them, while also trying to continue on with our day-to-day living. Creator, I want to ask for a special blessing for our elders and our children. And with everything that you have given to us so far, another day on your creation, I thank you for everything that you do for us, everything that you give to us, and not only pray for our community, for our people, but people as a whole, all around your creation. This has affected many lives, and we hope that we can get over this and then continue on, in this beautiful creation that you have given to us to live on. And with that, Creator, I thank you for everything that you have done for us, everything you give to us. And with that, I ask for a special blessing for everyone. And I thank you again. Aho.
Good morning, everyone. Heinepe, Clint, thank you for that blessing, and thank you for starting us off on this day with a thankful heart, and that we could be together today to celebrate a milestone in this historic time for the Winnebago Tribe and the world, really, and that all around the world a vaccine is being received in communities, and that the Winnebago Tribe and our leadership, felt that it was appropriate to start off with a prayer and to call on our own culture and our own indigenous knowledge, and to call on prayer and our spiritual leaders and our clan system to step up and fulfill the roles of and the duties that are vested within our clan system. And so it'd be really, it's really special that Clint could be here with us today with the 12 Clans Unity Hospital and the WCHS team, so that we could embark on this next step on the survival of our community, and that this is a somewhat of historical trauma coming back through our community with a sickness, and our people have seen sickness before and disease, and for that matter, who would have thought that we would see that in our lifetime, and that each of you would be a part of that, keeping our community well and safe, and that our leadership, both with the Tribal Council and the WCHS team, would lead us through this trying time, and that we would be making decisions for the survival of our people. So I want to thank you for being a part of that, and thank you for all the work that you do to ensure the safety, the wellness, and the livelihood of our tribal members and community members that receive their services here, and that are going to continue to look to this place as a light and hope for our future. So it's really special that we could be here in the spiritual room, and that we use this room to gather here, and that we would come together here. And right outside in this circle, we're going to be giving vaccinations to some of the employees today. And I just think that I'm really thankful to be a part of the council now, and that we could each work together, and that in Clint's prayer, he acknowledged that maybe Creator is trying to teach us something to come back together. And there's been phenomenal cooperation amongst our task force and our tribe, and all the resources that have come to the tribe. It's a real blessing. And so this is a part of the continued blessing that's going to carry us forward on our next steps. So I wish you all well, a happy holiday, a safe holiday, and that we just stick together, and that we work through this, because we're survivors, and we're hope made flesh. And we're going to talk about this and talk about how we're come together for the good of the people, and I really feel happy that I could share these things with you this morning on behalf of the council, and that they're fully committed to each step that we do to work through this pandemic. So thank you.
Well, last night the CEO, Denell Smith, called me and asked me if I wanted to be the first to get the shot. And I was kind of hesitant about it. And I told her, I said, yeah, I'll be the first one to jump up there. I have no problem with it. Because we get shots here, like the flu, it's mandatory, and just everyday life, everybody has to get a shot. We found out like a week ago that the vaccine was going to get here, and we just lost too many people here in the community to this virus, and if this stops it or eliminates it, and then I'm glad that we have it.
Okay, my name is Dylan Bearskin. I'm enrolled Blackfeet, and I live in Winnebago, Nebraska, and I work here at 12 Clans Unity Hospital. And it is December 17th, and I took the first dose of the COVID-19 vaccine. So with my work, I'm an EVS worker here, so we take care of cleaning and picking up blood and stuff like that. So our boss kind of contacted all of us and told us that as soon as they heard about it and they got approved and everything, that we would be getting it, our healthcare workers would be getting it. And basically the process was they asked if we were willing to volunteer to take it or not. And I said yes, and when I said that, I wasn't really expecting it, but I got a call last night during our meeting, and I was told that I could be one of the first ones to take it. So I just jumped on it and said, yeah, I wouldn't mind it. So my decision is based on, I think it's like a good first step to try to get people vaccinated. And I know it hits the community really hard, especially reservations. It's been different having to stay home and, don't get to exercise every day or see friends, see my grandma, things like that. And it's I had a lot of anxiety throughout it, and especially working here, I started and I worked with my brother here, and I was kind of scared the first couple of days because we had COVID rooms that we had to clean, and he told me I didn't have to clean them, so he cleaned them for me and taught me how to do everything. So. In school, it's been really different. Switched from being in person to all online, and just a really big change, and it's been not really hard to deal with, but just a new change that you have to figure out and how to overcome. I think the vaccine's a good thing. For me, I don't think there's really too much risk because we sat down and talked about it at our meeting, went over all the pros and cons, and there was a lot more pros than there were cons. And I think our community suffered a lot from COVID. And I think that the vaccine's really just a good thing, and it's a good first step for us. And I think you don't have to really be too afraid of it,
Started thinking who should be first, and if my people were gonna go ahead and take it, because we all had different emotions, we have different experiences, and that historical trauma that as Native people we have and we carry, that sometimes we question, and it's not bad to question, right? It's in our nature to be wary of things, but we always have to give it back to the Creator. And so as long as we put it in His hands and we pray, we know that He has helped guide these people to bring it to us. And so I always remember that, because last week I kind of was on the fence, and now this week I'm like, no, I won't let my people do something I won't do myself, right? And so leaders don't get to choose when to do things. They have to stand up and be with our people. And so I always remember that. And sometimes those are difficult roads to walk on. But I know that as EMS, my other hat, we see people at their best, but we usually see them at their worst. And we're their best hope, and this vaccine is our best hope. So this protects us to help continue our work. And of course, we want all of our people to get the vaccine because we can't lose anybody. Each Indigenous person is important and vital to our success as a nation. And so when we lose somebody, that devastates all of us because we've lost that knowledge. And so I remembered that. So then this morning, reached out to Isaac Smith, because that's kind of who we do for EMS. We kind of look to him. And so he started us off with a word of prayer, especially for our EMS providers, because we're going to have to still get up tomorrow and continue on tonight. And so he did that for us, because I believe in that, because that's who we are. And so, but this isn't the first time, and he reminded us that, some of our grandparents went through the Spanish flu. They might have been young, but some of them did, and they still are here today. We had centuries of, smallpox and other things that have been devastating to us. And so I think that with this vaccine coming to us, even first, is to send that message of how important each and every one of our people are. And so that's some of the thoughts that went through my head the last few days.
So I knew from the very beginning I was going to get the vaccine. Even before they had a vaccine out, I knew when one came out I was going to do it. You know, I just think it's not just for me that I did that today. I am doing this for my family, my community. I feel responsible, a responsibility to keep people safe that are around me. And I just think that that's something that I needed to do. And I have no regrets, and I am glad I've done it, and feeling great right now. So I read a lot on this, and you know, ever since COVID has started here, I go to the CDC website. I use a lot of that information, and a lot of it is so easy to read that I can understand it, and really anybody can understand it. So I go to that website and I just look at, you know, what are the experts saying? And I listen to the experts. That's how what we do in healthcare. We don't try to reinvent the wheel. We try to look at, you know, what people have already done and what they're seeing, and we go with that.
At 12 Clans Unity Hospital and the Winnebago Comprehensive Healthcare System, we have been paying very close attention to the CDC guidelines. And across the United States, the initial supply of the COVID-19 vaccine is being made available for frontline healthcare workers. And we know our frontline healthcare workers are right there every day. You know, they're taking care of our patients. And since the supply is limited, we want to make sure that they are taken care of first. There was a lot of discussion, and you know, I thought quite a lot about, as the CEO of our tribe's healthcare system, you know, is it better for me to step out in front and get it first, or to wait? At this moment, you know, I decided to wait because, first of all, I trust the vaccine. You know, there's been a lot of experts out there and a lot of people who've put a lot of time and energy and hard work into making sure that it's safe for our people. And so I trust it. At the same time, the supply is limited, and I want to make sure that those people who need it first, who need that protection and that safety in order to do their jobs for our people, make sure that they can get it. We went through the list, and we wanted to identify some of our community members who have stepped up and who have indicated that they wanted to get the vaccine, and who are well known in our community, and that we know, you know, people see them on the street. They're our brother, they're our cousin, they're our dad, and we wanted to show that they trust the vaccine, that it's important that we get the vaccine, you know, for their own safety, for our patients' safety, for our family, for our elders, for our children. And so we just really wanted to reinforce that message to the community about the importance of this.
Yeah, I think as I was sitting there this morning in the prayer service, you know, tears came to my eyes just because it has been very stressful. And I think what we've done and accomplished here has just been incredible, but it does take a toll on people. And it's taken a toll on me. It's taken a toll on a lot of people in this facility and the community. And I just really cannot. I mean, it's just something that I really felt a lot of emotions this morning.
I think that this entire experience has been a tremendous responsibility, but also a tremendous opportunity for our community and for our healthcare system. While it's been challenging and there was a lot of unknowns and a lot of questions, it has demonstrated what we can do when we work together. You know, not any one of us can know everything or do everything, and so that teamwork and all of the ideas and the discussion and just the hard work that has gone into responding to the pandemic, to taking care of our people, to helping our people who had to be on quarantine or who were isolated, to our ER staff as they helped take care of people when they came in and they were sick. Just everybody has been phenomenal, and I feel blessed to be a part of it. And I think our community has been very blessed to have the resources that it has had in order to help us to respond. But really, it truly is all about the people, and it's about our patients, and it's about taking care of one another.
So we still continue to have to do our precautions. You know, I'm gonna still be wearing my mask. And what we need is for at least 80% of the whole nation to get this vaccine, because that's the only way we're gonna have that immunity to be able to take these back off. But if people don't, then we're gonna be still wearing them, and we're gonna still continue that way. But it's gonna take a while. You know, this is the very first day, our first day, historic day.